Hi everybody, welcome to session 5 of the Prescribing Safety Assessment series. Today we will be covering calculation skills, and we are joined by the lovely Janice to man the chat and help me out today, so thank you for joining. Let me know if there's any issues with the mic or the video, but it should all be okay. Just a quick shout out, we're happy to be sponsored by Wesley and The Next Step. Here's the QR code. If you just have a little scan, you can find out more about them. They help to prepare you for the transition to your first foundation year and beyond, with lots of advice and support on career finances and also well-being. So do check them out, and you can find them on Facebook and Instagram. So for those of you who are new to the series, just a quick introduction. We've got Salmia and Balamrit, who are the chair and co-chair of the Keele Medical Education Society. We've got Janice, who's here today. She's the lead for the final year series. We have Dr. Akash Doshi, who's the founder of Mind the Bleep. I'm sure we've all heard about him. And we've got me, Dr. Petrosyan. I'm the lead for prescribing and the PSA series. Quick disclaimer, the PSA series for Mind the Bleep has been created by junior doctors who have a passion for teaching entirely on a voluntary basis. The aim is to teach from our experience and help ease anxieties around the exam. The lecture slides and content are accurate to the best of our knowledge, but please do note that we don't take any responsibility for any unintentional inaccuracies. If you notice any mistakes, please point them out and we will make sure to correct them. The full T's and C's can be found on this link. So we are on session 5 today, so calculation skills, and we're going to try and cover as many variety of questions that we possibly can in the hour to just give you an idea of what revision topics to cover. And then just going forth, we've got session 6 next week on medicine and surgery, session 7 on information giving, so on and so forth. And our final session will be a Q&A where as many of us as we can will attend that session. And if you've got any burning questions that you haven't been able to ask during the other sessions, you can ask on the 2nd of Feb. This is the blueprint that we keep referring to. So we've tried to make our questions and sessions around these topics and to cover as much of the blueprint as we can. Do have a look at this, because in case there's a few bits we've missed, just to make sure you cover the whole of the curriculum, which you can find on the PSA website. Today we'll be doing a Q&A based session with just a couple of the PSA recycled questions that you can find on the PSA website, just because there's no other way of rephrasing or rewording or coming up with new questions. It's just some things I think is important to cover. So we've got a 1-year-old girl suffering from a duodenal ulcer. She started on ranitidine, 4 milligrams per kilogram twice a day, and she weighs 9 kilograms. The solution comes as 75 milligrams in 5 ml. What volume is to be given each day? So majority of us, where's it disappeared to, went for 4.8 ml. Well done. That's the correct answer. I just wanted to highlight here, just to be careful in the question. Sometimes you'll be asked what's the total daily dose, and sometimes you'll be asked per dose. So make sure you read that quite carefully, because it could catch you out. So just to go through the explanation, 36 milligrams twice a day. The patient weighs 9 kilograms. That's 72 milligrams in a day. 72 over 75 times 5. That's how I normally do it. So the solution 75 and 5. We've got 72. That's kind of how I work it. I usually do 72 divided by 75 times 5, and we get 4.8 ml. So well done, everybody. Some of us went for the 2.4 ml. So I wonder if you read that as per dose rather than per day. Next question. Let's see if there's any questions in the chat. Okay. So we have a patient suffering from a severe acute exacerbation of asthma. They've had the initial management, which we discussed in the last lecture, about back-to-back nebulizations of salbutamol, ipratropium, and IV steroids, but the patient is still very symptomatic. So the next step in the emergency management is to give some IV aminophylline. This is the loading dose, so it's 5 milligrams per kilogram. and it's given by slow IV injection over 20 minutes. Patient weighs 60 kilograms. The solution comes as 25 mg per ml for injection. What volume is required for the loading dose? Right, I'll close the poll on that one. That was quite a quick set of answers there. Well done, everybody. So the correct answer is 12 mils. So well done. The majority of you got that correct. 60 kilograms times 5, that's 300 milligrams for the dose. Again, you've got 25 milligrams per mil. I normally just do 300 divided by the 25 times 1. You might have different ways of doing it. I think the PSA exam answers on the website has a slightly different way of working it out. Whatever works for you. I normally just say what I've got, what it comes divided by what it comes in times the volume, if that makes sense. So that's how I normally do it, but whatever works for you guys. This answer, if you can please pop in the chat. So the patient's had the loading dose, and now he needs to be continued on an infusion, and it's 500 micrograms per kilogram per hour. What volume should be administered each hour? So this one's a little bit tricky. I'll give you a bit longer. Do try and give it a go. I've had to prescribe this in an emergency, and it thankfully on our system in this hospital, it's kind of pre-populated for you, but in other hospitals where I've been, it's not. Where I've been working as a pharmacist, and I've had to try and help with the prescribing. So I don't know, it can be a bit confusing. So do give it a go for your learning, or you might not find it confusing. We'll see. But answers in the chat. There's no poll. I'll just give you till 28 past, just in case you're working it out, and then I'll go through the answer. We've got 30 ml per hour. Nice. Well done, everybody. We've all gone for 30, and that's absolutely correct. So well done. Just a quick explanation for those of you who haven't got to that answer just yet. So it's 500 mg per. We were told it's 500 mg per ml solution in sodium chloride, essentially. So you're putting the 500 mg into the sodium chloride, which gives you a 5 mg per 5 ml concentration, and that's also equivalent to 1 mg per 1 ml. So we've got 500 micrograms per kg per hour as the dose, times that by 60, that's 30,000 micrograms per hour, divide it by 1,000 to get it in milligrams, 30 milligrams per hour. We've got 30 milligrams divided by 1 mg times 1 ml, 30 ml per hour. So you've got a 1 mg per 1 ml solution, and it's 30 milligrams, so that's 30 ml. I hope that makes sense, and well done for those of you that have figured that out, because I struggled initially, so well done you. Next question, again, answers in the chat, please. So we've essentially got somebody who's hypoglycemic, and we're using the 20% weight per volume infusion fluid. What volume of the 20% is required to deliver 25 grams of glucose? I know the usual dose is 15 to 20, but just to make the numbers a bit more difficult, we've gone for 25 grams. So I'll explain the weight for volume on the next slide, but essentially it's grams per 100 mils. That's what the weight per volume means. So this 20% means it's 20 grams in 100 mils. We've got 125. Well done. Any more takers? So we've got 125, 25, 125, lots of 125s. Okay. Well done, everybody. So correct answer is 125. Just to go through the explanation. So 20% means 20% weight per volume means 20 grams in 100 mils. So that's what it comes in. We want 25. So 25 divided by 20 times 100. That gives you 125 ml. Weight per weight, if it was 20 weight per weight, that would be 20 grams in 100 grams. And then weight per volume is grams in 100 mils. So if you had 1% weight per weight, it's 1 grams in 100 grams. And if you've got 1% weight per volume, 1 gram in 100 mil. 5% weight per weight, 5 grams in 100 grams. So it's always in 100 grams in 100 grams or grams in 100 mils. And there's lots of there's lots of questions like this in the past papers online. So make sure you're familiar with the weight per volumes and the percentages. Next question, answers in the chat again, please. So we have a 58-year-old man admitted via ED with suspected food poisoning. He's got severe diarrhea and dehydration with low potassium. He weighs 68 kilograms. These are the investigations. So his kidney function seems fine. And he's been given some IV fluids with some added potassium. And the question is, what dose in millimoles of potassium will have been administered in the first 5 hours before he has his blood test? So I've taken this from the PSA website, and I believe from memory you have to click to see this chart. So if you have questions like these, make sure you click the extra button to see the chart. I'll just give you a few minutes to do this. Great. So we've got lots of 40s and a 4. I'm assuming you probably mean 40. Well done, everybody. So it is 40. So just looking at the chart, the first hour is 10 millimoles, next 2 hours is 20, and then the next one is essentially just a fraction. So you need another 2 more hours out of the 8 hours to make that up to 5 hours. So 2 divided by 8 times 40 is 10. So add that all together, that's 40 millimoles in total. And we have a 50 as well. Just have a look at the maths again. It's 40. So you've got 30 from the first 2 bags and then another 10 from the next bag. Next question, answers in the chat again, please. We have a patient on warfarin, and he's normally on 7 milligrams and 5 milligrams on alternate days. Warfarin comes as 1 milligrams, 3 milligrams, and 5 milligram tablets. Also comes as 0.5, but you don't see that as much. How many 1 milligram tablets will Mr. Hanson require for a 14-day supply if he was to start on 7 milligrams as the first dose? So we've got a nice range of answers again, what I love to see. So we've got 14, 96, 28, 7. I think the majority of the vote goes for 14. Correct answer is 14. If you've got you should be able to have a piece of paper or something to hand. It's easy. It's easier if you jot down sort of just quickly into a table like this and just mark how many of each for the 14 days. I can't imagine, if you do get a question like this, I can't imagine it to be, months and months worth. So I think if you just, for me, it's quite, I prefer to set it out in a table just to visualize how many. So if we start on day 1, you'll have 1 of the 5 milligrams and 2 of the 1 to make the 7. And then you'll just have 1 of the 5 the next day, so on and so forth. And yeah, you can just tally up all the numbers. This was quite a straightforward amount to count, but you might have to be using 1, 3s and 5s on certain days. So you might find it helpful to put it in a little table format like this. So 14 was the correct answer. Well done, everybody. Next question, I believe, is a poll. So you've got a 27-year-old man presenting to the ED with abdo pain and vomiting. He's got arteritis. I think it's a vascular sort of condition. Prednisolone, 50 milligrams daily is what he takes for it. He's currently unable to take medication orally and so requires an equivalent dose of IV hydrocortisone. We've been very conveniently told that 5 milligrams orally of pred is the same as 20 milligrams IV of hydrocortisone. So what dose should be given every 6 hours of the IV hydrocortisone to provide an equivalent dose of the steroid? So have a go on the poll, and I'll give you a few minutes and go through the answer. So just to answer the number of tablets question, you've got a very valid point there. I just think in terms of ease, it's easier to give a 5 milligram and a 1 milligram than to give 2s, 3s, and 1s, if that makes sense. Because then on the days where he's just taking 5, instead of taking a 5 milligram tablet, he'd be taking a 3 and 2 1s. So it just complicates things, and there's more room for error. Does that make sense? So it comes as 1, 3s, and 5s. But he didn't necessarily have 1, 3, and 5. That's just what it comes in. But for ease, it makes more sense to give 5 milligrams than a 3 and 2 1s. I wouldn't worry too much about that. If there's ambiguity, then they will say, you know, how many of the 2s and the 1s or the 5s and the 1s do you need to give? But just in terms of sort of safety and ease, it makes more sense to take 1 tablet on the day for the 5 milligrams rather than a 3 and 2 1s. There's less room for error for the patient. Go with the 50. So the patient normally has 50 milligrams of prednisolone. What's the equivalent of that for the hydrocortisone? I'll give it one more minute. Well done, everyone. So the majority of you have gone for 50 milligrams, and we have a few 12.5s and some 100. Right, I will close the poll. Well done, everybody. So the correct answer is 50, and this is an example of reading the question carefully, because it could either ask for the total dose or the dose to be given every 6 hours. So well done. The majority of you picked up on that. So yeah, 5 milligrams equivalent to 20 milligrams. So it will be 200 in a day. Divide that by 4. That's 50 milligrams per dose. So well done, everybody. Next question, answers in the chat, please. So Mr. Harper is struggling to swallow his tablets. The SALT team, which are the speech and language therapists, have recommended to convert his tablets to liquid forms for easier swallow. He usually takes 20 milligrams citalopram daily. What dose in milligrams of oral citalopram drops should Mr. Harper be prescribed for an equivalent switch? So you might need to use the BNF for this. Those eagle-eyed of you will also notice this should be question 10. I've switched them over. That's why it says 11, in case anyone points that out. So the majority of us say 16 milligrams. You might also be asked how many drops. So again, read the question properly so that you can put the right number in. But this, you're correct, because I've specifically asked for milligrams. So most of us have gone, or all of us have gone for 16. I'll just give you one more minute in case there's people still catching up. Okay, well done everyone. The correct answer is 16. If you go onto the drug monograph for citalopram, there's actually a lovely section in there to talk about dose equivalencies and conversions. So 8 milligrams of the drops is equivalent to a 10 milligram tablet. So if you want 20 milligram tablet, that's double the 8, so it's 16 milligrams. You're also told that the 8 milligrams is 4 drops. So if you were asked how many drops, then you just need to double it to 8 drops. So well done, everybody. And then this was the question I was going to put in if we had time. So we do have time if you guys want to have a go. So this is Medicines Complete. We just had a question in the chat about what website. So this is Medicines Complete website. Have a look at the first lecture in the PSA series. There's a whole lecture on how to navigate it. So have a go at this and pop your answers in the chat. So we've got what volume is required for each dose and what is the total number of ampules required for the duration of treatment. So, well done everyone for answering. So we've got each dose is 6 mils, 12 ampules in total. And someone's asked a very good question about keeping the leftover ampules. We've got 60 ampules as well as an answer. So we'll go through the answer. So well done everyone. It's 6 ml per dose. So that's two ampules a dose. So that would be 4 ampules in a day, and because it's a 5-day course, would say 20 ampules. This isn't in the BNF, but generally, once you open something, you should use it immediately. I can't imagine them to leave the ampules open and then go and come back, because you could get contaminations of the ampules. They could get mixed up. So, and in the product characteristics, it does say once opened, it should be used immediately. So, in this instance, then you would be using 2 ampules and then another 2 ampules for the rest of the day. You wouldn't need to kind of wait and draw up the volume later on in the day and add another ampule. So because of contamination and that sort of risk, you would be using new ampules. I just wanted to get you kind of thinking, and you did all think along the right lines and ask the right questions. In the exam, I can't imagine there to be any ambiguity. I'm sure they would say, once you've used it, you can't reuse it, or make it quite clear in the question. But in a practical sense, you wouldn't be saving an ampule from the morning till the afternoon or something like that. If there's a really, really, really expensive drug and it's for a patient specific, and you're just going to use it on them and you can't get hold of any more, then maybe you can do that. But in these instances, you dispose of it once you've used. But well done, guys. That's good thinking. I think that's all for the question. So hopefully that's kind of covered most of the styles that the PSA have on their website as well. If you could please do the feedback, let me know if there's anything else you want to improve on, anything that went particularly well. All feedback is really, really welcomed. And it also helps me for my portfolio. So I'd be very much appreciated if you could give some feedback. Next up, we've got Prescribing in Medicine and Surgery by a colleague of mine called Dr. Schofield. And then on the 15th of December, we've got Information Giving, so counselling. That will help in the info giving section of the Blueprint by some more colleagues, Dr. Bed and Dr. Vincentelli, and I will be around to man the chat.